Medication Administration Training Program. Giving inhaler medication.
Please follow along with the procedure guide for giving medication by inhaler and for giving medication by inhaler with spacer as we demonstrate this procedure. If you choose to wear gloves, put them on. It is important to wear gloves if you believe you may come in contact with the child's bodily fluids. If the child is coughing, or if you feel you might come in contact with the child's mucus, you should definitely wear gloves. Some inhalers come with a cap. If so, remove it. Check the mouthpiece for any stray objects before using the inhaler. If the inhaler or the consent form indicates that the medication needs to be shaken, then shake it. Hold the inhaler between your index finger and thumb. Just before giving the medication, match the 5 rights. Have the child put the inhaler mouthpiece into her mouth and close her lips loosely around it. With the child's head tilted slightly back, ask her to take a slow, deep breath in. As she does this, press down on the inhaler canister to release 1 puff. Do not administer more than 1 puff at a time. Tell her to hold her breath for a few seconds, then breathe out with her lips pursed. If the child gets 2 or more puffs, make sure you know how long to wait before giving another puff. Some children want to take the medication quickly and won't use the right breathing techniques. You may need to coach the child on how to breathe when using the inhaler. Always watch the child while she takes the medication. The parent may have provided a spacer to use with the inhaler. A spacer is used to help the child get the full dose of medication by holding it in the chamber long enough so the child can breathe it in with multiple breaths. To give inhaler medication using a spacer, follow all the steps above, but be sure the child understands that after getting a puff, she will need to breathe in and out into the spacer at least 3 times to be sure to inhale all the medication. You may need to demonstrate this and coach the child before and while she receives the dose. After giving medication by inhaler, wipe off the inhaler mouthpiece with a clean tissue and replace the cap. If you are wearing gloves, remove and discard. Have the child rinse her mouth with water and then spit it out. Make sure the child does not swallow any of the water. This helps to avoid getting a fungal mouth infection called thrush.